My subject for today has to do with techniques and material selection for Optimum Aesthetics. Having said that, there are many things that play into the decision as to what materials we decide to use and the longevity and success of those materials. Most of those other components are going to be addressed in this series. Certainly occlusion and treatment planning are major components in the success or failure of these restorations. And also a consideration is that many of the things that we're going to talk about today may change in coming years because this is an area where there's a tremendous amount of activity in research and development, and monthly we see new materials available. So what I'm going to try to do is focus on particular considerations as we make these decisions that will carry over into new technology. In other words, what are the things that we look at day in and day out when we treatment plan that lead us to the materials decisions we make? There are several what I call primary considerations that I go through with our students as we treatment plan aesthetic cases. And I want to go through those primary considerations and elaborate on the various components and how they affect our choices. First of all, and probably one of the more important considerations we'll talk about, is what does the patient expect? What is their vision of what we are going to end up with as far as appearance, longevity, comfort? What do they expect from this treatment? Secondly, what are some of the occlusal challenges that we face with a particular case? We'll elaborate on that. What's the preoperative status? Does the tooth have a previous restoration on it? Is the tooth discolored? What are some of the situations that we have to deal with in a particular case because of the preoperative status?